Hi, thank you so much, Becky, for that lovely introduction. I am Veronica, and I'm a clinical psychologist, as Becky says, who works as part of the Living Well Cancer Psychology team, which is based at Southmead Hospital, so as part of North Bristol Trust. And I'm here to talk to you today about coping with anxiety and fear, and I guess more specifically, the fear of recurrence. So I'm really conscious that there is a room full of people here who all have a different relationship with that word sarcoma, what that word means to you. You may be somebody who's been recently given that diagnosis. You may be somebody who's going through the process of treatment. You may be having follow-up care, or this may be something that you experienced a long time ago. But I'm also conscious that there are friends and loved ones here, and it may be that you've been experiencing somebody very close to you going through this experience. So I guess what I want to start with is this analogy, that this experience is a bit like getting on a roller coaster ride, but of course this roller coaster ride was one you didn't choose to get on. And I think what's already been highlighted this morning is that your roller coaster ride may well have even started before you got given the diagnosis. And then you go through this experience of attending multiple appointments, having treatment, and it's all the ups and downs of what a roller coaster ride might bring. And then, of course, you get to the end. And what is the end of this roller coaster ride? Well, you're asked to sort of step off, perhaps. It may be that the main form of your treatment comes to an end. And there may be actually quite a lot of expectation, perhaps from others, that, okay, great, you're done, off you go. Carry on with the rest of your life. But actually the ground might still feel a little bit wobbly. You may feel that you're still really feeling affected by what you've been through. There may be some real changes that you're still coming to terms with. And of course, it may be that you're sitting here, if you're somebody who's been alongside somebody who's been through this experience, that you yourself may have felt like a passenger on this roller coaster ride. So how are you feeling? Well, what we hear, and I have the privilege of talking to many people who kind of go through this experience, and what I pick up is that it is common to feel a range of emotions when you go through or you're recovering from treatment. So worry, frustration, sadness, guilt, these are all normal reactions. There is no right or wrong way to feel. It's so easy to compare ourselves to other people, isn't it? Particularly in this day and age. And unfortunately with that often comes a sense of self-judgment. Perhaps I should be feeling different. We hear that word a lot. I should be feeling perhaps more grateful of the care that I'm receiving, perhaps. But there is no right or wrong way to feel. And certainly people ask us, is it normal for me to feel this way? And often the response is yes. This is a normal reaction to what's inevitably challenging experiences. So as part of that, what's very common is the fear of recurrence. And I just want to point out a definition of what that actually is. So the fear of recurrence is the fear, worry, or concern relating to the possibility that cancer will come back or progress. And the reason why I'm sharing this is, of course, it can be something that you experience after treatment, but it may be even as you're going through it, you're noticing that you're worrying about the future. And we hear that a lot. So are you fearful? Are you anxious? Well, you're certainly not alone. And in fact, one study identified that 45% of those treated for sarcoma reported high levels of the fear of recurrence. We also hear this in the clinic rooms that we work. We know that this is a really common thing that people sit with and struggle with. It was also identified that it's considered one of the most unmet needs reported by patients. And okay, this is a paper that came out about 12 years ago, and we hope that we're working towards meeting those needs. But it's part of the reason why I'm really pleased and privileged that Sarcoma UK have asked me to speak about this topic today, in really working towards recognising that this is a need that needs to be met. So putting this all into context, what I'd like us to do is think about where our minds go. So I'm just wondering, if I was able to tap into each and every one of your brains as you were on your journey on the way here this morning, I wonder how many of you were really focused on the journey, noticing what you could see, what you could hear, what was happening around you. And how many of you were actually thinking about the day ahead, or even thinking about this evening, thinking about what you might eat later, or thinking about yesterday, or what's been happening in the week? Chances are that you probably weren't focused in on the moment, because what we know is roughly 60% of the time our minds take us forwards or back. And this is because we have these wonderful brains that have evolved over millions of years that really give us this opportunity to plan ahead, to think ahead, and to use our past to learn from experiences. So they are these incredible brains that we have. However, if we add into the mix when we experience the threat of cancer, let's think about what that means. It means that it's very common for your mind to go back and think about the difficult experiences that you've had. So difficult memories may come up. You might still be trying to kind of make sense of what's been going on. So how did this happen? It also means that it's likely that your brain is going to go forward to thinking about the future. And of course comes with that concern about the risk of cancer coming back. What if it comes back? And these brains that so fundamentally want to plan will be asking that question of, well, can I plan ahead? So let's think about the impact of anxiety. And I'm just going to go through a couple of questions that you yourself can just sit with and read and just think, does this resonate with you at all? So first of all, do you become hypervigilant when you experience anything that you can consider maybe a symptom? Does it make it hard for you to focus on daily tasks when you notice that you're starting to worry about things? Does it get in the way of you experiencing joy? And does it prevent you from making future plans? And I guess if the answer is yes to any of these questions, we can really recognise that it can have an impact, and it does have an impact on people's lives. So with all that in mind, let's think about what helps. So what can you do? Well, what I'm going to share with you is the Serenity Creed, which says, grant me the ability to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So this picture here, what I'd like you all to do is think about, it's a bit like that all of us are out on our own boats out at sea. And of course, we may go through some really challenging experiences in life. And I think it's fair to say that going through an experience of sarcoma is challenging. So what this is like, it's a bit like the weather being very stormy. And of course, thoughts and feelings around that can also feel really challenging, as we've highlighted. So the point here is we might not be able to change the weather, but what can we do to steady our boat? So firstly, let's think about those clinic appointments that you have. What we would really emphasise you to do is discuss your concerns. We work very closely with the clinical teams, and they're always there. They want to know where you're at psychologically as well as medically. And we would always say, do ask if there are things about your condition that you want to know more about, or that you're struggling, because it's really important that they know. And they are there to help support you. So learning about the meaning of symptoms can be really beneficial. Things to perhaps to look out for, but also things not to feel concerned about. And of course, that's where the clinical teams can be really useful to have those conversations with. We'd also emphasise to say, do seek support. And of course, there is Sarcoma UK, but I guess directly with your clinical teams, you can always ask about referring on to psychology, and hopefully they would be able to assist you with that if you really feel that actually your concerns are getting in the way of you being able to live your life. But this is also about recognising what you've got for yourself. So building your own mental toolkit. And the first step here is just to ask yourself, do you feel anxious? What do you notice about what's going on for you? Really acknowledging what's coming up can be a really, really important and often neglected first step in thinking about what you can do to help support yourself. It's then asking yourself the question, how have you dealt with uncertainty in the past? These experiences don't happen in a bubble. We all have life experiences, and there may be strategies and strengths that have helped you in the past that may be able to help support you now. There may be people around who can help support you. We would also say approach rather than avoid fears. It's so common, isn't it, for us, if somebody's kind of going through something difficult, we might hear that phrase, or just don't think about it. We might say that to ourselves, we try not to think about things, but that's so much easier said than done. And actually, we would encourage you to do the opposite, to really kind of make sense of what might be going on for you, encouraging you to express yourself. So it may be about writing a journal, or if that's not something that you're kind of interested in doing, think creatively, maybe draw your fears creatively. So it's about being creative with kind of really addressing what's coming up. And talking to others. So talk to others and let them know what you need, but we also emphasise maybe it's important to tell people what you don't need too. So coming back to this understanding that it's really understandable that our mind is constantly going forward or kind of going back. Actually, what can be really helpful is with the recognition of this, really helping yourself to focus on the present moment. So going back to the boat analogy, it's kind of like dropping an anchor in the present moment. And one way of doing this is practicing mindfulness. So mindfulness is the practice of paying attention to the present moment with curiosity and kindness. But what does that really mean? And I guess one way to think about it is that whilst our mind is going to do what it's going to do, think about ways that you can come into your senses. So really taking a moment just to notice what you can see, smell, feel, touch, and hear. A really good example of this is so many people recognise that if you kind of go for a walk in nature, for example, that can feel good, can't it? Because naturally what you're doing is engaging with the outside world. Getting yourself out of your own mind can be really beneficial. So it's just taking a moment to notice what's going on around you in any given moment. There's a lot of research to show that mindfulness can be beneficial. So it can lower anxiety, depression, lower stress levels, and it can really increase a sense of well-being. It helps people to cope with pain, fatigue, build resilience, and even improve people's immune function. So if it's something that's of interest to you, I would definitely recommend it as something that can be highly beneficial. You may turn around to me and say, actually, it's not avoidance that the problem is a problem for me. It's actually the fact that I just get so caught up with these worries, and it can be very difficult to kind of sometimes look beyond this worry or this fear that's here. And if that's the case, what I'd encourage you to do is think about this. You are not your thoughts. Thoughts are incredibly powerful, and they can really guide us in terms of what we do next. But we often talk with people going through this experience about imagining that perhaps your thoughts are like on your fingers, and imagining when you're really scared and feeling worried about something, it's very difficult to see beyond your fears. But just being able to do that, it's not about saying that the fears aren't there, it's acknowledging it, but then it gives you a bit of space to be able to say, okay, I notice I'm feeling fearful, and given everything that I've mentioned this morning, it makes sense. It's really understandable that that's going to be there. But are there other ways in which you can respond to this fear that's going to be more helpful for you? And by that I mean, have a think about what you could do that matters to you. So it may be that we can't get rid of this fear, but is it possible to feel the fear and do it anyway? Susan Jeffers was somebody who went through the experience of cancer herself, but she was also a psychologist. So this statement was her legacy. So asking this question, when you look back at this time, how would you like to remember how you spent it? Are there particular things that you're not doing at the moment that actually just engaging with those things you know are going to make you feel better about who you are and how you spend your time? Are there particular people in your life that you want to be kind of connecting with? So really, what does matter in the deepest part of your heart? And are those things present in your day-to-day life at the moment? Be kind to yourself. We often say this to people and people say, I don't really know what that means. I hear about this, but what does that kind of even look like, to be kind to yourself? Sometimes people can feel a little bit allergic to that as an piece of advice. And if that's something that you notice for yourself, perhaps you could ask yourself the question, well, if this was a good friend or family member feeling this anxiety, what kind words would you say or deeds would you do for them? Sometimes a little bit easier if we're imagining that it's happening to somebody else. And then using that to think about, could I apply that for myself in this moment, recognizing that this is tough? So coming back to the analogy of being in our boats, I hope what I've done in this presentation is help start to think about what it means to be able to drop an anchor, because of course we can't change the weather. So we've talked about perhaps addressing your concerns with people around you, thinking about things that have helped in the past and recognizing your own tools and strategies that you can bring to this situation. Think about how often your mind goes forward or back, and consider whether it might be helpful to find ways to just take a moment to focus on the present. Be kind to yourself as well. So I'm going to end with this quote, which was from Nelson Mandela, and he said, "The brave man is not he who does not feel afraid, but he who conquers that fear." Thank you for listening.